All right, let's review the ligaments of the ankle joint. So we have the tibiofibular ligaments. You have an anterior and a posterior tibiofibular ligaments, and they are shown, put a different color on here, shown right here. So you have the anterior tibiofibular and the posterior tibiofibular, and they are just connecting the tibia and the fibula. And again, a, a strain or a tear or a micro tear on these ligaments is considered a high ankle sprain. Then on the medial and lateral side of your calcaneus and talus and tibia and fibula, you have the medial ligaments, which are called the deltoid ligaments, not to be confused with the deltoid muscle, but they call it deltoid because there's three and they're kind of fanned out. So you have the tibionavicular, the tibiocalcaneal, and the tibiotalar. And they just tell you exactly where those fibers or that ligament goes. So tibionavicular goes from the tibia to the navicular. Tibiocalcaneal goes from the tibia to the calcaneus, and tibiotalar goes from the tibia to the talus. There's fewer medial ankle sprains. Usually your ankle doesn't roll in, and these are much thicker ligaments compared to the lateral ligaments, which we'll look at right now. So now we're looking at the lateral side, and we know that because we can see the fibula. So the ligaments on the lateral side, which are more frequently injured, right? A lot of times your ankle rolls, and when you roll your ankle, your heel is pointing in, so you're putting a stretch on these lateral ligaments. And we have the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. And again, their names say where they go. Anterior is on the front part of the fibula, from the fibula to the talus. Posterior is from the posterior on the fibula to the talus, and calcaneofibular goes to the calcaneus. And then you have the interosseous ligament, which we've seen before, and that usually tears. Actually, let me back that up. You typically fracture your fibula before you tear that ligament. It's so strong. And so a lot of times you'll have a distal kind of avulsion of the fibula. So you're going to break your fibula before you tear that very strong ligament.